Hi there, my name is Ashley James and we're starting a mini webinar series just to talk about various topics that can help you in and around work. And this first topic, which is a topic I really enjoy talking about, is this idea of resilience. So we're going to go through a few things nice and quick on this webinar to talk about how we can try and foster the resilience that we already have and how we can perhaps develop further resilience in the future. So these terms you're probably relatively familiar with, robustness and resilience, but what are they? So robustness is the ability to be strong and in good condition, and it's the ability to withstand or overcome adverse condition in the first place. And resilience is kind of what happens after the fact. It's our ability and our capacity to respond to pressure and the demands of daily life, both physically and psychologically. So robustness can reduce the risk of sustaining an injury in the first place, and resilience can allow effective coping and recovery from a specific injury. And that's very much the topic we're going to concentrate on over the next few minutes. So we're made up of our individual traits, whether that's physical, so all of the things that you see there, our strength, power, endurance, flexibility, those things that you're familiar with, and also our psychological traits. How stressed we are, our optimism, how much job autonomy we have, our relationships at home and in work. And all of these get thrown into the melting pot, and then out the other side comes our resiliency and our levels of robustness. So all of these things contribute to how resilient and how robust we can be. When we think about resilience, it's the resilient people accept what comes at them, and they're flexible rather than rigid. So rather than failing or breaking, they're able to bend and move and be acceptant of what comes towards them. And something that I think is a really important point is that it's not a passive quality. Some people might think that resilience is innate, and some people are resilient and some people aren't resilient. And to a certain extent, some people will be more resilient naturally than others, but it's very much an active quality and an active process, and we can, through using various techniques, make ourselves more resilient. And it's very much a personal journey. It involves our thoughts, our behaviors, our actions, and our past experiences, and all of those again go towards our resiliency levels. And it's down to this capacity versus demand scenario. So if we have our couple of little friends here, our duck and our man, we have us, and we have a job task, for example, and we have all the qualities that we've discussed. So the strength, the mental agility, the power, we have all our physical traits that go to our resiliency and robustness level. And then we have the job task, whether that's the load of something we have to carry or move, the frequency we have to do it, the distance, whether we require a specific skill, whether it's really stressful from a cognitive point of view, and that might be because of pressures from a boss, from colleagues. The task itself might be difficult to complete mentally. You might have to do it over a long period of time. And our resiliency is whether we can cope or balance out our individual traits with the job task itself. Whether we can be resilient to it is down to all of these factors. So when we think in terms of physical resilience, how can we develop our physical resilience? So improving our general qualities of the muscles and our bones and our nervous system and all those other inbuilt things that we're probably a little bit more familiar with, and this might seem really obvious. So our range of movement, our strength, our endurance, our balance, and our power. So if we improve all of these, we can generally make ourselves a little bit more physically resilient to the tasks that are ahead of us. But there's also a few other things that are important, and movement variability is one of them. So practicing movements and having the ability to move in lots of different ways. So not just being able to bend down in one specific way, or not being able to just kneel or bend our knees in one specific way, but to be able to do them in lots of different ways is also really important. So that variability of movement, and not just the variability of movement, but the ability to do them and perform them in lots of different contexts is also important. So it may be that you can lift something up and move something very easily in the gym, but when you're in work and there's time pressures and boss and colleagues and that context, that makes us a little bit less resilient physically because of all those different other factors. So exposing ourselves to activities in lots of different contexts gradually over time is a really useful thing to be able to do. And the more different contexts we can expose ourselves to, the better. So whether that's the place that you're doing it, the type of activity you're doing, the temperature, the weather, all of those different things, the more context we can do, the more resilient we can become physically. Another obvious one being in general good health. So, being generally of a good weight for our height, not smoking, having a generally good diet, good blood pressure, low alcohol intake, all of these things obviously are helpful in developing our physical resilience. And this, again, something that you may not have been aware of, but good sleep is also really important. We do a lot of important things when we sleep. Memory consolidation, we do a lot of repair to our muscles and our bones and our tissues when we sleep. It's a really important thing. And it's not all about the length of sleep either. The length of sleep that we require will vary from 7.5 hours to 8 hours for most people, but it's also the quality of that sleep. So is your alarm waking you up every morning? Do you wake up naturally? Most of us should be able to wake up without the use of our alarm, and that indicates a good quality of sleep that's been had. So moving on to the other side, how can we develop psychological resilience? Keeping good company. So social support and interaction, both at work and at home, are vitally important for our psychological resilience. In times of hardship, both physically and psychologically, having people to be able to turn to and interact with is really, really important. Having the ability to reach out for help is also really important. It's not something men historically do very well at doing. Asking for help is really important. And treating any problems that we come up against as a learning process. So trying to flip it on its head, really, and trying to take away the view that all problems are an issue and are going to be detrimental to us in the long term. Flipping that round and thinking any problem that we come across is an opportunity. It's an opportunity to learn, an opportunity to grow, and trying to flip that optimistic mindset. Practice and acceptance, stress and change and pain, particularly injury, it's a part of life. If we look at the statistics for lower back pain, 80% of us will experience lower back pain in our life. It's likely going to happen. These things happen. We need to accept that they are going to happen, and when they do come along, know that in the majority of cases, it's not going to be life-changing. It will come, it will go. And also taking a wider view and getting some perspective and looking at what is important for you in your life. Is work the most important thing? Is that job you need to do for your boss the most important thing? Or is the fact you've got a family at home, can that mitigate some of that stress that you're feeling at work? Accept it and move on. Celebrating your success, really important. If you do something well, make sure that you celebrate it, people know about it, and that you're enjoying the successes that you're having in life. It really drives us forward in times of hardship, remembering those times of success and understanding that those times of success can come again in the future. Take positive action, and this, as a physiotherapist, this is something that I really try and instill in everyone that I see. The main person that can get you better is not a physio, it's not a doctor, it's usually you. Taking positive action towards your own recovery, both physically and psychologically, and that goes back to asking for help again. Keeping good company, using problems as learning process. Positive action towards problems is always a useful thing to do, and will help build that psychological resilience. And practicing optimism, and this is a big one. This is a mindset, and sometimes this can really help change the way that you see problems and really go towards improving your resilience. So nothing is either wholly good or wholly bad. Just having that viewpoint that whatever comes at you, sometimes something positive can always come out of it. And that brings us to the final concept, this take-home concept that I want people to go away with. So sometimes when you're in situations of hardship, like I've said, either physically or psychologically, it can feel like you're quite isolated. And what we need to do is give you the ability to be able to get yourself out of those problems and building that resilience. And it starts with optimism, as I've just said. An active lifestyle, goes towards all those other physical resilient traits that we've talked about. So being stronger, more powerful, having more range of movement, but also variability in different contexts, and having general good overall health. That physical activity is really important. If you couple your optimism and your activity, you will get to being more resilient. That is the main message, that we can move towards resilience, and it's an active quality that you can develop yourself, and one leads on from the other. Thank you very much for listening. I hope you've enjoyed it, and if you have any feedback, then please send it through. Thank you.